Good morning, everyone, and welcome. It's really great to see you all here again this morning, and thank you very much for coming last evening and for your participation in the session and for at the reception as well. I'm Wafa El Sadr, and I'm really very happy to serve as a moderator for the first session this morning, which is I'm going to introduce the speakers in a little bit. But before we get started, we thought that it would be interesting to give you some feedback on the results of the survey that was sent out to the participants of this workshop before the workshop itself. And to share with you some of the findings from this survey, I'm going to ask my colleague, Dr. Miriam Rabkin, to present in brief some of the findings, select findings from the survey.
Thank you. It's such a pleasure to be here with you and to share this workshop. Thank you for coming. As Wafa said, we sent out in advance, as many of you know, a survey to participants. We sent you a link to an online questionnaire that was anonymous. There were only 7 questions, and we got 28 responses. So thank you very much for that information. I'm just going to share, as Wafa said, some of the selected results. So if for those of you who answered, that's what it looked like. The survey had questions in both English and in Turkish. And we asked you if you currently worked directly with refugees, forced migrants, or displaced people. And so 3/4 of you did work directly with refugees. We said, if you do work with refugees, what best describes your role? And so the number one answer was physicians, was doctors, and then people who worked with local Turkish NGOs, and then a really nice diversity of other representatives. The first question we asked was, in the context of thinking about refugee health and health systems, what did you think were your own most important professional challenges? And these were the answers. So the first was language, communication barriers. The second was inability of Syrian doctors to work in Turkey, which actually we heard yesterday may be changing, so that's great. Issues around funding shortfalls, although I think there was also the recognition that the government has been extraordinarily generous in its funding. The lack of records for chronic care. And so some of you were talking about vaccination records, and some of you were talking about other types of records, for example, for non-communicable diseases. Some of you talked about the lack of treatment resources, especially for specialized services, like for children with cancer, chemotherapy, things like that. And as we heard yesterday, lack of information about the disease burden amongst refugees. We also asked about your perceptions of the most important training needs or needs for capacity building. And again, the most frequent response had to do with communications. And this was both literally language training, so speaking in Arabic, but also cross-cultural communication. And also there were some other issues on this slide, including the use of data for strategic planning, how to work with both public and private sectors in a response, and then several of you mentioned training on humanitarian principles or social mobilization. We asked you what you thought the most important policy questions were. And there were many, so I tried to just pick a representative sample. But so some of you said there were questions about the ability to analyze the impact of current policies and regulations. Several people again addressed this issue of how would it be possible to integrate Syrian health workers, doctors, nurses, and others into the Turkish health system. One of you said, from the perspective of public health, is it a loss or a gain to provide health services to refugees? Several people spoke about where's the best place to provide health services, and this was both geographic, meaning at the border as they come in or where they end up, but also the issue that we heard about yesterday of integrating services versus parallel services for health workers. We asked what you thought the most important research questions were. And these are some of the examples. So again, thinking about the data, the epidemiology, what is the burden of disease amongst refugees? What is the impact of refugee health on the health of the general population? Questions about cost and resources, and again, questions about this, the ability to leverage Syrian health workers. And one of the respondents said, this may be a mirage. There may not, in fact, be enough Syrian health workers in Turkey for that to be the only solution. So there were questions, research questions about that. And then finally, we asked what would make this workshop a success. And I think these answers will not surprise you, but there was a lot of interest in experience sharing, particularly among different sectors, the government, non-governmental organizations, and academia. An interest in comparing Turkish policies to those of other countries to identify areas of improvement. And I think that includes both improvement for Turkey, but also improvement for other countries, bilateral. Thinking about identifying optimal systems of care, identifying ways to expand the health workforce. And then I'll just leave you with this last response, which I thought was poetic response to the questionnaire, which just said, if this workshop touches the reality of the refugees' lives, then it will be a successful one. So again, we're just sharing these data to frame our work together today, and to start off the conversation. And again, thank you very much for giving us those data, and we hope that we can come back to many of these issues during the day.